Hi there, Dave Markham here for the Brock Porter. We're talking about the Brock Porter Book of the Month. And this month, November 2012, we've been reading Dylan Ratigan's book, Greedy Bastards, How to Stop Corporate Communists, Banksters, and Other Vampires from Sucking America Dry. I didn't particularly care for the title. The book is a lot better than the title. I think probably Mr. Ratigan used that title just to sell copies and grab attention. But what the book is really about is the various systems that we use in the United States to manage and govern the various sectors of our society, like education, finance, healthcare, energy, and so on. And his systems analysis is very readable, and I have found the book very interesting. And earlier I had written descriptions on the Brock Porter about previous chapters, but chapter 4 is on the healthcare system, and I thought that maybe I'd make this video to stimulate the discussion on the healthcare system in the United States. It's a very interesting chapter, and as Mr. Ratigan says, the U.S. spends twice as much on healthcare as most developed countries, and it gets far worse outcomes on most indicators. For example, the U.S. is ranked 50th in life expectancy, behind countries such as Greece, Portugal, Bosnia, and Herzegovina, and 37th in infant mortality. John Boehner, the Speaker of the House, gets up there and he says the United States has the best health care system in the world. That's a lie. Maybe Mr. Boehner, as a Republican congressman, has good health care because he has a governmentally funded health care plan for him and his family, but most Americans aren't treated as well as our U.S. senators and congressmen and other federal employees. So what Mr. Boehner is referring to, again, is to the relatively small number of people, while the majority of people in the United States suffer from a very inferior healthcare system. The major problem with the healthcare system in the United States is that the capitalists have turned it into a profit-making business, and it's no longer a profession that's devoted to healing and human service. The funding mechanism for our healthcare system is based on a fee-for-service model, which means that physicians, clinics, and hospitals get paid for treatment services, not for promoting and helping patients maintain their health. Physicians and healthcare organizations are paid for outputs, that's treatment services and procedures, and not for outcomes. That's good health. As a psychiatric social worker and a mental health professional, I have seen many examples of this, and I could keep you here to midnight telling you about the dysfunctional aspects of the financing of our healthcare system and how that actually works against patients, not for them. And the healthcare provider is forced to maximize their profits or revenue based on what payers, healthcare insurance companies, are willing to pay for. It has nothing to do with your health. It has what to do with how the health insurance companies can best make their profits. Because the system is designed to pay for treatment procedures rather than results, the paperwork and administration is staggering. About 30% of every healthcare dollar in the United States goes for administration and paperwork. One of the things that Ratigan quotes in his book is in 1999, the U.S. spent about $1,000 per year on healthcare administration per patient, while in Canada they spent $300 a year. Also, Medicare, depending on how you calculate the cost, spends anywhere from 3 to 6% on paperwork and overhead, while commercial health insurance companies spend about 30 to 35%. So during our last presidential election in 2012, when Paul Ryan and Mitt Romney were saying that they wanted to voucher Medicare, it would be a disaster. These guys have no idea what they're talking about. The Medicare system is extremely effective, it gets good outcomes, and it's extremely efficient. Most healthcare dollars are being spent to promote health, not for administrative overhead costs. Physician fees and other healthcare costs are manipulated by various insurance companies, and the marketplace is heavily influenced by various stakeholders based on multiple factors having to do with financial incentives to those in a position to manage these systems for their own advantage. So you see the healthcare system gets skewed in the direction of profit, not in the public interest. One of the most egregious examples of this is the pharmaceutical companies and how they market their pharmaceuticals to physicians to promote the purchase of their drugs, as well as the TV advertisements. But most egregious is their healthcare lobby, where they actually wrote the legislation for Medicare D prescription drug plan under the Bush administration, which was horrendous. As Ratigan points out in the Time magazine in 2004, they said that the pharmaceutical industry topped the list of the most profitable industries with a return on revenue of 17%. The health insurance industry in the United States is one of the most dysfunctional aspects of the system, is how Americans have chosen to finance its operation. And Ratigan writes on page 2002 in Greedy Bastards, quote, "We are the only country with a voluntary, primarily employee-sponsored health insurance system, and it will always be expensive. Parenthesis, we spend more than any other country, close parenthesis, bureaucratic, parenthesis, we spend more on paperwork and the people who process it than many countries spend on actual health care, close parenthesis, and patchy, parenthesis, before the new health care law passed, 15% of Americans had no health care coverage, compared with just 0.2% of Germany, close quote. It will also create barriers to the best possible care, because decisions about what care you get must be negotiated with your insurer. In other words, if you come down with illness X and they cover drugs as treatment for X but not surgery, you'll be under financial pressure to switch. Your care will always be some compromise between what you and your doctor think is best and what insurance will cover. The United States is one of the few countries in the world that ties health insurance to employers. Whether you get health insurance and what kind depends on where you work. This arrangement drives up the costs of goods and services as compared to countries where health insurance is a governmental responsibility and companies do not have to provide this employee benefit. It also ties employees to employers when they would rather change jobs or start their own business. In the newly developed global economy, this system of financing healthcare puts the U.S. at a distinct disadvantage in competing with other industrial nations. The healthcare system in the United States is extremely dysfunctional, and the primary reason for that is because it has been structured as a commercial profit-making industry. It's not. It's a healing human service profession. And the primary values and ethics should be based on patient care, not on profit. And so the old physician's motto, primum non nocere, meaning above all else do no harm, does not apply to our healthcare system, where there is tremendous harm done to individual patients as well as us as a nation. I highly recommend Dylan Ratigan's book, Greedy Bastards, and his 4th chapter on healthcare. And I look forward to any comments that you might have on this topic. Thank you.